I would like to welcome Brittany Anderson with HealthFirst Bluegrass. She's here to share with you about the variety of services that they provide and then answer any questions that you might have. So without further ado, I'm going to turn it over to you, Brittany.
Thank you. Hi, guys. I'm very happy to be here with you all. I feel like I've gotten to work with so many of you on different projects, and yet usually it's all communication via email or phone call and don't get to really be on video calls with you all. So I'm happy to have you all. Have a little presentation about Health First. It's a lot of information. I'm going to try to roll through it as quickly as I can, and then try to leave some time at the end for questions. So I'm going to go ahead and get started with the presentation. All right. Does not appear to be in slideshow mode. So one moment. Okay. Rainey, are you seeing my screen, my slideshow?
Yes, looks
Okay,
good.
perfect. All right. So just a little bit about HealthFirst Bluegrass, you all may or may not be familiar with. So we are a federally qualified health center housed here in Lexington. We have a few different locations, and we provide integrated care with medical, behavioral health, women's health, dental, pharmacy, and more. And I will be honest, I have been in healthcare for a long time. I have been a school nurse in another state prior to coming here, and I did not know what an FQHC is. So a few fun facts about federally qualified health centers. We are regulated and do receive some grant funding through HRSA, though the majority of our revenue stream is through billable visits. Our board of directors has to be made up of at least 51% patient representatives, and those should be reflective of the populations we serve. So whereas some structured organizations may have a board that's just appointed by government officials or appointed by their leadership, ours are chosen through a selection process, but we have to always keep that 51% patient representatives. So that really makes sure that we're meeting the needs of our patients and our communities. We also have to have a sliding fee program in place to ensure that everyone has access to quality care. They mandate that we screen for things like food insecurity, housing insecurity, and other social determinants of health, which I know is near and dear to your all's hearts as well. And then we provide wraparound services like interpreters, community health workers, outreach and enrollment specialists, and have after hours things. So those are some things that kind of make us stand out from like maybe a private organization or something like that. So then when we talk about school-based clinics, that is an extension of our integrated healthcare model, but plopped down within 10 of our Fayette County public schools. So what that looks like is that in each of our school-based clinics, we have medical and behavioral health care 5 days a week. It typically looks like a nurse practitioner or a physician's assistant, along with a nurse coordinator, a clerk, and a behavioral health therapist. And then we have some extra services that's not daily, but we have psychiatric med management on site at least 1 day a week at each location. We have dental services provided at each of our school-based clinics at least one semester, and then our mobile dental van that some of you all are familiar with. And then we also have access. So we don't have our community health workers on site at all of our schools other than Tates Creek High School, but we can always reach out to our community health workers at our main sites or outreach and enrollment specialists who help people get signed up for Medicaid, Medicare, that type of thing. And then, like I said, Tates Creek High School was our first school-based site to have a CHW on site. So on the screen, you will see our schools. We currently have 8 elementary clinics, 1 middle and 1 high. So just a little bit about where we've been. I know some people who have been in Lexington for a while are surprised to hear that our first school-based clinic actually opened in January of 1995. So this past January was the 30-year anniversary of our first school-based clinic at Harrison Elementary. And then there's kind of a timeline. They did them kind of in chunks of 3, renovating spaces to add a clinic. So there are plans to put a clinic in the Henry Clay High School. And then I know you all are familiar with the district facilities plan. There are plans to put additional clinics in on some of those higher need areas as well. So just a brief snapshot of what we do. We have registration clerks in our clinics that greet patients as well as students, teachers, staff who walk in because we can see patients from outside of the school as well. They schedule patients by phone and call students to the clinic at the time of their visit. They keep a list of all the students in the school. We update that monthly. Our school health lead, who may be on here, Hadassah, runs a list from Infinite Campus of all the students who have dropped and added in that month so that we can make sure we're keeping an active list of the students and who does and does not have consent for our clinic. And then they can complete the registration process. Our therapists on site can provide therapy services for things like depression, anxiety, anger management, school-related problems, coping with change, moving, divorce, and death, and then problems with social skills or trauma. So they use individual sessions, parent sessions, and family sessions when needed. And then I'm sure some of you all are familiar with them because they collaborate with the school support teams quite frequently to ensure that students are referred to the appropriate level of care. Our RN coordinators, we kind of think of their role, they wear lots of different hats. So they're kind of the little mini practice manager. They're the on-site leader of the clinic to coordinate daily activities, troubleshoot problems, collaborate with the school to ensure that the clinic is successful. They also maintain all the supplies in the clinic, the vaccines and that type of thing, in addition to serving as the school nurse. So at the 10 sites that have school-based clinics, we actually serve as that school nurse as well and train the staff to administer medications, work on field trip plans, the health plans for students with chronic illness, and all of that, in addition to responding to emergencies and then supporting the providers in the clinic. And then our medical providers, so most of them are advanced practice registered nurses. One is a physician's assistant, provides acute and well visits for students as well as patients who do not attend that school. So we are more than happy to accommodate students from other schools and family members. They don't even have to be a student in Fayette County. So we serve as the primary care provider for many patients, but we also will do acute care for students. They may have a PCP at Lexington Clinic or at UK, but they're down in the clinic with a fever and we call the parent and they're like, yes, please go ahead and see them. So we can go ahead and do their sick visit and test them for strep or flu or whatever at that time. So we can do well visits, annual physicals, we have vaccines we can give them, sports physicals. Sometimes we do pre-op clearance for patients who are about to have a surgery, sick visits, lab work, we can draw blood on site and send that off. And then when the RN coordinator is out, that nurse practitioner or PA acts as kind of the backup to the school nurse. Our psychiatrists or psychiatric APRNs do med management for things like depression, anxiety, ADHD. Our mobile dental van visits each of our school-based clinic sites once a semester, and then they come to 15 other FCPS sites. They do things like preventative care, but also the restorative work. So one thing we found with dental is there's been access to dental care is tough everywhere, but a lot of times we were seeing that we were able to do those exams and create a treatment plan, and then getting the follow-up with the patients was hard to really complete. So we identified they need all these fillings, but getting them to come back for the fillings was tough. And you really want to prevent that decay. Once you've identified it, you need to stop that progress right then. So really focus this year on shifting the model a little bit to be sure that not just doing that preventative, but we're able to fully wrap around and get that restorative work as well. So we restarted a partnership with the UK College of Dentistry this year. So that's a little bit confusing because it's two separate mobiles that are out and about. But they were really focusing on wrapping up those treatment plans. So getting those fillings done, getting those sealants on the kids to make sure that we're getting their mouth healthy and not just identifying the needs. So we are working to revise that process. We know we ran into lots of issues with mobile this year. So we're working hard to brainstorm for next year to make that a smoother process. So thank you for your patience. A little bit of impact. I don't have the most updated numbers since we're not quite done with spring of 25, but on the screen, you'll just see kind of a summary of how many visits we've done each school year. The numbers had been trending slightly lower in the fall because we've had some provider vacancies that some of them have been filled, some have not, but we're still working to fill those as quickly as possible. And then at the bottom, you can see kind of the top reasons for visits that we had. So lots of respiratory infections, as you all can imagine, lots of physicals, that type of thing. Some ear infections here and there. This is kind of another view. We present to the board every year. We show, I think much like you all have to do reports of the impact that your work is making in the school, we show that impact report as well. So this is just kind of a snapshot. So in the 23-24 school year, we provided over 10,000 visits to over 6,500 patients. So very, very pleased that we can provide that really in the school communities, meeting students where they spend so much of their time. I'm going to not go through all of this, but really it's just, I know Rainey is going to have the slides available in the recording, but really it's just kind of a snapshot of how we use the integrated care. So if a student has come down multiple times, the nurse has given them a snack, she's noticing a trend that they've been seen multiple times, the nurse practitioner has already assessed them. There's nothing physically wrong. Then she may touch base with the teacher and see if there's any changes the teachers notice in the classroom. She may call the parent then and explain what she's noticing and see if the parent knows anything that's causing it. And if they suspect any level of anxiety or underlying emotional component, then she'll tell the parent about our behavioral health services and offer that. And then if the parent's interested, the nurse sets up the patient with an intake with our therapist. And then they can initiate therapy, and if needed, they can identify the need for getting established with one of our site providers for med management. So we really try to loop all those pieces together to be sure we're identifying really the root cause of what's going on when we have these kind of vague, non-specific symptoms at times. And then the last thing I kind of wanted to touch on is just the relationships. Again, I know I'm preaching to the choir with you guys because this is what you do all the time is build relationships with those families. And that's what we really push our staff to do is be out in those schools, get to know the families, get to know the staff, let them know that we're here and able to help. So this top left picture is some of our crew that was the Arlington team at the time, doing a parent night, passing out some little goodies and talking about our services. The top right picture is the lobby at our Breckenridge Clinic. The bottom left is the lobby entrance to our Tates Creek Elementary Clinic. And then this bottom right is an exam room at our Tates Creek High School Clinic. So most of our exam rooms are a little tighter than that. Tates Creek High School has kind of the luxury exam rooms with a little extra space, with that being a new build. But most of them are a little tighter, but we can do a full range of services there. But with those relationships, I just think about like we had a trafficking situation that we became aware of with a student who presented in one of our clinics because when she had finally gotten in touch with somebody, they advised her to go to the school nurse. And so she ended up in our clinic. And through a series of things, our community health worker is able to work with the youth services coordinator and be sure that this student is getting all the services that they need and we can get them to a safe place and back reunited with their family. We had a family waiting on us in the clinic at one clinic after they had been involved in an armed home invasion the night before. And the student was very traumatized. And mom was like, I didn't know where to go, so I just came here. And so building those relationships is what leads to those things, as you all know. So we really work with our staff in that. And then any opportunity we have to get out and interact with families, share about our services, talk with you guys or anyone in the schools, we love to do that. So thank you for partnering with us in that. And then if you want to know more, we have monthly HealthFirst Bluegrass 101 events where community partners can come to our Southland Drive location. They hear from our leadership team as well as some frontline staff and then take a tour of that clinic. And then we're also, Rainey and I met recently and we're going to plan some tours for the school-based clinic. So if you all want to come and see where you would be, telling parents they can go, you're more than welcome to come to one of these clinics and do a tour to see what it all looks like and meet the staff. And then if you would like more information or want us to attend an outreach event, probably the best way is to reach out to Hadassah Wardle, who is our school health RN lead. I put her HealthFirst email account there. She also has a Fayette County email address. And we're happy to see if we can get staff to come and pass out flyers, or we really ask them now to take their laptops and we can get them scheduled. We can almost always schedule patients same day. So we are happy to work with you all to get patients in if needed. So that is the presentation. And then I just wanted to be sure that I got done in time for you all to have a chance to ask questions. So do you all have questions for me? I see a question in the chat. Let me read that. It says, do parents need to apply for financial aid if their child does not have or qualify for a medical card or any type of health insurance? Yes, so that is a newer thing in our clinics. We are required now by law to make some attempt to collect payment. So a self-pay patient out of pocket, as you can imagine, would be quite pricey. But we have lots of programs in place to ensure that financial barriers are not a thing. So we have a sliding fee scale. We can do it with parents at any of our clinics. It's very super helpful for them. They have to give how many people are in their household. And I meant to put a screenshot on that on this PowerPoint and I did not get it in there, but they show how many people are in their household, what their income is, much like what they do for the free and reduced lunch, that application that they do for that. It's very similar, but it's a one page. They fill that out and then they have to show proof of income if they have it. If they do not, there's a waiver that they can sign just attesting that they don't have proof of income. That's our last resort. Obviously, we would love to have proof. And then we put them on a tier based off of that. So it may be a $20 copay. It may be a $30 copay, depending on their poverty level, that type of thing. But then we always say, like, our messaging to our clerks is really just ask, like, you have a $20 balance. Would you like to pay on that today? So we don't want people to have to pay the full amount if they can't. We will accept $2 if that's what they want to pay. But also, I think there's a level of dignity that you give people when you give them the chance to pay for something rather than just saying it's free. And so some patients have liked having the opportunity to pay when they can, to pay something. And then if the copay or balance is too much, we also have a hardship program that our community health workers can help them apply for, that can totally take care of it. And then last case scenario, we have a patient assistance fund as well. So we have multiple layers of support to ensure that financial barriers do not prevent anyone from getting care at our clinics.
There's a question in the chat about, do you have any flyers or materials that they could have on hand to refer them to the clinics since they don't have one on site?
Yes, absolutely. Most of the school nurses have them. I know we work closely with the health department nurses, their leadership team. So we have some flyers and they typically ask for some because I know their nurses like to keep them in their little space. But I can absolutely get some of those to Rainey to distribute, or I can send them. I guess I can send them interoffice mail through Fayette County, but I know we're almost done with school, so I would have to get a move on that quick. But yeah,
we're here all summer. So
okay. Does the interoffice mail run all summer? I just wasn't sure.
It does.
Good.
Okay. Yeah.
Great. We can for sure get that to you all. We have things that show our services, how they can reach us. I will say our Tates Creek High School clinic is open all summer except July 4th week. We're going to close. I laugh because, in schools, waxing the floors in the summer is a big deal. So we always have to have at least a week that we're closed for floor waxing because that is a necessity. But we're open at Tates Creek High School from 8 to 4 the rest of the summer. So we can see any and everybody. Most times we can see adults, kids, it doesn't matter, babies. We love to see everyone we can.
You. send that document, would you be able, one of the questions is to get a PDF copy of the consent. So if they're working with a parent, and if they're
Yeah.
translated, that'd be even better, because I know
Yeah,
this
we have
is
it
Spanish.
English, Spanish, French, Arabic, and I think Swahili. I'll have to look.
Okay.
So yes, I can get those to you all. We do ask to have a consent annually. I will say we have different versions of our consent that are varying lengths, and that's really confusing to people. And the reason for it is that the one at our 10 school-based clinics includes a health history, because parents may sign that and send it back in, and then we may not be able to reach them, and their medications could have changed, their allergies could have changed. And so if we're seeing a 6-year-old who the parent has given us consent to see, and we've seen them a lot before, and we know a parent wants them seen, but we can't get them on the phone that day, we just want to be sure that we have the most updated information that we can. So we do a health history annually when we're sending them home in backpacks with the kids at our 10 sites. But families at the other sites don't have to fill out quite that much information. So I will get those all to you. That's a great question. We also are planning to have staff at the back to school rallies, the YMCA back to school rallies. So we'll have staff on site at most of those. We're hoping to be at all of them. We'll see who we have available.
Any other questions?
I know one thing that has come up is, can staff bring students from other schools without their parent? And the answer is kind of vague, as you would imagine. Parents can fill out what we have. It's called like a consent for additional adult to provide care. So we can send that electronically. Parent can consent for a coach, a principal, whomever, to bring a student. So as long as we have parent consent from our standpoint, it's fine. Transporting the student obviously depends on specific school guidelines and guidelines for your role of what you are not allowed to do. But from our standpoint, all we would have to have is that signed consent from parents that the additional adult can bring that student. So we have had sometimes coaches fill them out to bring kids for sports physicals. They'll have the parent sign it, and then they come with them if parent can't get off work, that type of thing. Any other questions? I will say we have lots of availability. I just looked at our schedule for Tates Creek High School, and there's lots of availability. So if anybody is working with their schools to get ahead on kindergarten physicals, 6th grade physicals, sports physicals, anything like that, we are happy to get any and all scheduled. Typically, there's less sickness in the summer, so it's more all the vaccines and back to school prep. But we do have therapists working this summer and our psych providers. So we can continue that med management. We can continue therapy, whether it's in person at Tates Creek High School, in person at one of our other locations, or virtually. And then I also should mention, we in the past have kept LTMS open. I don't know what day we're switching to calling that Lexington Middle School. I know their name changed, but I don't know when their timeline is.
I think it's July 1.
Okay,
Yeah.
I've got a little bit left of LTMS to adjust. Okay. We do not have that one open this year, but one of the reasons being our Met location, so Midland and East 3rd, it's right down there by DV8 Kitchen, really close to William Wells Brown, if you're familiar with that area. That location is open all summer during the week and on Saturdays, actually. And we can see adult and peds patients. We have dental on site there Monday through Friday. And we have a pharmacy on site there as well. So that site has plenty of access. So any of our patients can be seen at any of our locations. So if you have families in the downtown area that are needing care, we can absolutely have them seen there. I saw something in the chat for the Tates Creek High School number. Yes, I can give that to you. Let me pull it up real quick and I can just type it in the chat. All right. We are working on the plan for next year for dental. I know mobile dental is a big need. Um, and we, just for a little context for you all, with the UK mobile, the x-ray is like a couple step process. So when we do x-rays on our mobile, you can see them right away in the computer. When they do it on their mobile, then somebody from our staff has to bring it back on site and then load them into the system. So there's a bit of a delay in that. And I spoke earlier about, we really wanted to be sure that when we're doing visits with students for dental, that we're able to complete those treatment plans and actually get the fillings done and the sealants done when they need them. And then we obviously ran into a big hurdle this year with our mobile breaking down and parts not being available. So we are planning, have some work group sessions to try to improve the dental access next year. I don't know exactly what that looks like, but we will for sure regroup with Rainey and Debbie Bowen and share that out whenever we can. Questions? I know we're almost out of time. Is there any other questions while I'm here? I will get all of those documents to Rainey to send out to you all. We will get the dates that we're going to have some tours of the school-based clinics. We're probably looking to do those in September. I know August is a bit nuts in school, so we'll wait until around September to do some of those. But you are always welcome to reach out. Again, I will include my email, but also Hadassah Wardle's email. She is our school health lead, so she's really the point person for and kind of a liaison between HealthFirst Bluegrass and the district. So making sure that we're meeting the needs of the district and up to date on all things that are happening. So she's usually a little quicker to respond than I am. So I will include her email as well.
Any last minute questions?
Well, thank you so much, Rainey, for giving me this opportunity. It's been
Thank you. Thank you for
wonderful to just have a chance to put it all out there and tell you all the things. So
yes, and I will share this video with those that could not join us, so that no one misses the information. And I will wait to do that until I have the PDFs that you were going to share. And that way they'll have it all in one package.
great.
All right. Thank you so very much.
Thanks, everyone. Have a great summer.
Yeah, guys, thank you. Have a great rest of your day. Bye.
Bye.